Hi everyone, my name is Dr. Marco Caravaggio and I'm a pediatric and family wellness chiropractor in Markham, Ontario. And I have a question for you. Do you or someone you know suffer from low back pain that's not necessarily across the whole back, but it's more specifically to the right side or to the left side? I'm going to be showing you a very specific kind of trick exercise that might be helpful in certain cases when there's pain going down the side. These are the nerves that are coming out of your spine. And this is like a really exaggerated version of a bulging disc. So these are the discs here, and if you look at this one right here, it's kind of bulging out to the side. The vertebrae in that area have kind of like opened like this and kind of caused some squishing, and there's pressure for the disc to bulge out that way and irritate the nerves. So here's the front, we're going to turn it around. This deep muscle in here called the multifidus muscle, which if this gets activated, it might help to kind of close down the gap on that side. But you have to do it in a very specific way, depending on which side your pain is. So I'm going to go into the next room. I'm going to just show you briefly how to do that. Because what happens is, when I want to raise my arm out to the side, if I don't activate certain muscles in my body, the weight of the arm will actually cause me to fall over. So we're using that little technology. There's something called a shunt stabilizer muscle, which is that muscle there. So we're going to do a specific exercise in a specific way that might help to contract it, to maybe reduce that sort of bulging. It might take some pressure off the nerve and help you alleviate some of the pain on that side. So let's go to the other room and I'll show you how to do it. Let's say your pain is on your left side, going down into your left area down here. What you need to do is take a fairly light weight. I'm just using like the supplement we have in our office that helps to restore intestinal health. It's called Restore. So this weighs maybe a couple of pounds. And what I'm going to be doing is I'm going to be raising it on the opposite side of where my pain is. So my pain is on my left side. I need to raise it to my right, and you're raising it up like laterally. Don't bring it up in front of you like this. And you're going to want to don't let it drop down like that. Keep it horizontal so that it's straight and your arm is straight like this. And so you're just going to have a fairly good posture, and you're just going to raise it up to the side and then bring it back down. So let's say you're just going to do maybe 10 repetitions like that. You could even do 15 depending on how heavy it is. And you do that a few sets a day, just like that. And then if your pain was on the right side, obviously you're going to switch it over and you're going to raise it to the opposite side like this. Okay? So that's the exercise. Give that a try. And obviously if you've got persistent discomfort, we'd like to see you in the office to take care of you properly. This is something you might want to do in the meantime, just to give you, maybe take a little pressure off and give you some relief. So give that a try at home. Okay, so hopefully that was helpful. Obviously, if you've got some, pretty pronounced back pain, it didn't just happen when you first started to feel it. Most of the time, people have had problems in their spine, in their back, and their nerves for quite some time before the first kind of blowout, or when they have these really dramatic episodes. So if you'd like to get that looked at properly and professionally, that's what we do every day. Chiropractors are the experts in nerve and spine health, and we look at these, thousands of them every year sort of thing, so that's our bread and butter. So typically when people come to me, there's an exam that takes a full hour. There's a consultation, and there's an exam where I'm testing you with some instrumentation. I'm putting through a bunch of neurological tests to kind of see if we can figure out just the general health of their nerve system, top to bottom, inside and out. And normally that's $170, but with this ad here, we're just promoting our office with a special lower price for that initial exam. So somewhere on the page there'll be something to click on that you can take advantage of that special offer at limited time. So hopefully that was helpful, and if this was helpful, please share it with other friends that may have this problem, and hopefully if you'd like to come into the office, we'd like to see you in our office. Take care.